स्वास्थ्य बीमा सम्बन्धी ऐन बैठकको औपचारिक एजेन्डामा परेको छैन, तर यसलाई विशेष मेहनत अनुरोध गरेर आजकै बैठकबाट पारित गराएर छाड्ने भन्ने भएकोले त्यहाँ उपस्थित हुन अनिवार्य छ। त्यसैले मैले शुभकामना दिएर मात्र त्यहाँ जान चाहेँ, म यसको लागि क्षमा माग्न चाहन्छु। Mr. Chairman, Honorable State Minister, distinguished guests, participants and friends, I would like to thank and congratulate National Health Research Council for organizing the 3rd National Conference of Health and Population Scientists. While we are making our effort to provide quality and affordable health care for all of our citizens in every corner of the country, the role of health scientists has been valued greatly. In this background, the conference has brought together about 1,000 experts in this field together to generate and disseminate new knowledge in the sector. I am delighted that the organizers have chosen Sustainable Development Goal as the theme of the year, as the theme of the event. The SDG not only include outcome indicators of healthcare, such as reduction in infant and maternal mortality. Moreover, it also broadens the scope of health policy by including goals in the area of water, sanitation and hygiene, as well as reduction of poverty and hunger. I believe this very same spirit has been captured by our Constitution. The Constitution guarantees basic health care as a right, while indicates emergency medicine, reproductive health and health insurance as state responsibilities. Furthermore, the Constitution lists nutrition and drinking water as rights of the citizens. Following the spirit of our Constitution and the goals mentioned by Sustainable Development Goals, the Ministry has initiated active engagement in air pollution, water, sanitation and hygiene. We have submitted an action plan to the Cabinet to reduce and control air pollution in the country, and we expect this proposal will also be discussed in today's Cabinet. We are working with partners to define and implement new standards for drinking water that regulates the water being distributed and sold in the market. Over recent months, we have developed important policies for reducing the use of harmful products, particularly by our youth, such as tobacco and alcohol. We are in the process of introducing new taxation on sugary drinks and alcoholic drinks. These initiatives help us to maintain people's health, but we have been equally aggressive in expanding access to health services. The Ministry is currently finalizing a 7-year integrated health infrastructure plan that will ensure public health services are available in their communities and tertiary services within their geographical and financial reach. This will prohibit haphazard development of infrastructure based on undue political pressure, but based on population density, service needs, and in line with constitutional provisions. The bottleneck that we face for this expansion of healthcare services is the availability of specialist doctors. We are approaching to fill this gap with partnering with a number of organizations. The Ministry will continue to invest in public health initiative, a cornerstone of our health system. As we move forward, we must do better to address the growing burden of non-communicable diseases. We have recently introduced the pain package for prevention and early detection of non-communicable diseases. We see this as a critical component to detect and treat diseases early before they grow and cause social and financial hardship to our citizens. We are also starting a new year-long national campaign from the very first day of Vaisakh 1st. So I will take this opportunity to invite all of you to join us at 8 a.m. on the Vaisakh 1st. The rally will start from Rangasala. Right Honorable Prime Minister has also given his consent to inaugurate the function. This will be a 1-year national campaign, and the campaign is on the theme My Body, My Responsibility. I'll brief you about this campaign later on the day of the event, but I invite you, all of you, friends from ministry, friends from media, and also friends from other organizations, please join us on Vaisakh 1st, 8 a.m. That rally will start from Rangasala. We must also bring services closer to where people live. We are now empowering municipalities to set and operate urban health promotion centers. And there are a number of other policy initiatives which I believe my friends from Ministry will share with you. Before I conclude, I would again like to congratulate National Health Research Council, and also would like to mention this particularly to the scientists who are present here and friends from abroad as well. As we are right now working on the policies, number of policies. What we have observed is that if there are enough evidences, if the policy is based on evidence, that will help us to achieve the result. That will help us to bring real changes. Intention is not only enough. Intention is not only enough. We need to have we need to generate evidences, we need to have data, we need to have number of other supporting arguments. That is why we want to value the scientists, we want to value the work done by Research Council, we want to value the work done by other independent scientists as well. That's why we welcome all of you to join hands with Ministry. We encourage evidence-based policy making. That is why we are trying to collaborate with a number of agencies as well. That's why we welcome a number of other proposals which have been brought forward by National Health Research Council. We want to not only increase the resource allocated to Health Research Council, but we'd also like to encourage the independent researchers to come up with your proposal. Ministry would like to join hands with you. Thank you very much. I wish all the success for this grand event. Thank you very much.